Okay, what do you think is one thing that the average person needs to know to advocate for research like this?
You know, I say an ounce of prevention is worth a pound of cure. So I think they need to understand that advocating for as early intervention as possible. Like, we know these diseases have poor long-term outcomes, but we're excited by the great short-term outcomes. I think they have to understand that just because it has like a good short-term outcome doesn't mean that the long-term outcome is beneficial. So we have to really get in there and do better, you know, earlier on, so that way we can head off these long-term problems. So for instance, in these diseases that I talked about, we know that they can survive, you know, for the most part, their early childhood if we just do what we were normally doing. And that's great. You know, that didn't exist 50 years ago. But we can and should be doing better now. We have the technology, we have the tools, right? We need to let us get in there and intervene early and study these diseases earlier to see how we can get in there and make an impact so that we don't have these long-term problems. So that way when they're 15 or 20, they're not needing liver transplants, heart transplants, long-term drugs. We don't want these kids to be on drugs for their whole life.